and get started. All right, well, welcome to our industry expert webinar series. Today is a very special day because we are welcoming to our webinar Brooke Anderson, who is from our Canada location as well. So just a little bit about Brooke. She is coming to us with over 10 years of experience in the skincare and the beauty industry. And she brings with her a vast knowledge and a definite passion for training skin therapists all over the world. Now, I know Brooke herself, actually, we've talked, has had some own personal struggles with her skin. And this was definitely a catalyst for her into becoming a skin therapist and at one of Canada's top skincare centers. And then a goal that she's always had is to help really change people's lives through healthier skin. Now, Brooke is the National Accounts Instructor for Dermalogica Canada, and she heads up our development of curriculum for Dermalogica's top Canada chains. And the really helps to motivate our professionals at these locations to really be the top tier skin therapist around the world. And she's really always constantly training and inspiring and motivating and pushing our skin therapists to be their personal and their most business successful and at their best. So I'm going to hand it over to Brooke, who's going to go ahead and talk all about our topic today, which is going to be acne deconstructed.
Awesome. Thank you, Beth. Thank you for such a wonderful introduction. I must say I am so excited to be here with all of you. I'm seeing everybody typing in where you're joining us from, and this is so exciting. So hello to everybody from a very sunny and humid Toronto in Canada. My name is Brooke. I'm going to be taking you through today's information, which, as Beth said, is really kind of near and dear to my heart. Even though I am a passionate skin therapist, I have a passion for education. Acne is an issue that I know not just myself, but I'm sure many of you, and of course, many of our clients have been dealing with, whether it's in the past or currently. And when we think about acne, it can be really difficult to figure out what the best way is to treat an acneic skin. And how do we really treat that skin so that we can see results and that we can make a change in our client's skin health? So today we're going to spend some time kind of chipping away and digging a little bit deeper beyond the surface of the skin, beyond what we just see during our face mapping, to really understand what the contributing factors are to cause acne, and also what we can actually do in terms of ingredients that will specifically address those specific contributing factors. So I know we've got a lot of juicy information to cover today. So as Beth said, any questions, you can type them into that Q&A section. But let's go ahead and let's get to it. All right, so what are we going to be talking about today? Let's start off with a quick little agenda so we're all on the same page of where we're going to be journeying through today. First and foremost, we're going to take a step back and just talk a little bit about what actually acne is, right? We use this word a lot. Our clients throw the word acne around, and there is actually still a lot of misunderstanding when it comes to what acne truly is, and then of course, how do we treat acne? We're also going to take a step and look at the follicle that is responsible for acne in the skin. So we're just going to be kind of digging a little bit deeper into this follicle and having a look at those contributing factors, which there are 4 of. So as I mentioned, when we're looking at these contributing factors, the goal is not to have us feel like we need to repeat this information or try and teach our clients all this nitty-gritty histology and science. But the goal is to help equip you as professionals in the industry to have a deeper understanding of these contributing factors so that we can really use ingredients to get the best results. We're going to chat about a little bit of additional triggers outside of course, those 4 contributing factors that are happening within that follicle. And then we're going to kind of wrap things up by just reminding us of some professional treatment options and what I like to think of as the 360-degree treatment approach. So what can we do outside of home care, but bringing that client in for the professional skin treatment to ultimately help them see the change that they want to see? So let's go ahead without further ado. And I'd love if everybody would open up their chat box, and I'm going to have my eye on it. It's the bottom of my screen here. And I just want you to think of the word acne. When you hear that word or when you think of that word, what are the words that immediately pop to mind? So just type in any of the words that come to mind when you think of acne. embarrassing, excess sebum, inflammation, oil, breakouts, painful, pustules, sore, unsightly. Oh my gosh, you guys are amazing. I can hardly even keep up. Sensitivity, absolutely. Stress, that's an excellent one there. Scarring for sure. Awesome. Discomfort, perhaps food allergies, uneven texture in the skin, maybe bacterial impacts. Absolutely. Age, okay, awesome. Hyperpigmentation, oh my gosh, and the list goes on. Thank you all so much for typing in those words. So definitely, when we think about acne, all of these issues come to mind. The fact that it can be stubborn, it's hard to treat. Maybe there's dehydration coming into the skin or showing up on the skin, I should say, in addition to that breakout activity. Maybe there's a hormonal impact. Maybe we see scarring as a side effect of those inflammatory lesions. Skincare challenges, you know, our clients coming to us and saying, what should I do? I don't know what to use. I've tried everything. Maybe it's pustules. Maybe it's that pigmentation or post-inflammatory hyperpigmentation that's left on the skin once that breakout subsides. There's the emotional component. I know a lot of you said it can be frustrating. It can be, you know, embarrassing for us and our clients. There could be oiliness. There's congestion, so that under the skin breakout activity. The papules, you know, those painful lesions that almost feel like they have the heartbeat of their own, right? Stress, bacteria. There is so much to consider when it comes to looking at acne in the skin. And it's no wonder why our clients think, well, I don't even know where to start. How do we even know how to tackle this issue when there's so many things that we have to consider? So we are going to go ahead and dial things back a little bit. Thank you for your interaction, everybody. And we're going to talk a little bit about what acne actually is. So we've all been there. We've all had that pesky breakout, right? That pimple, that pustule, where maybe we do a little bit of bathroom surgery, we start picking, popping, squeezing. And we all know how frustrating those breakouts can be. But imagine that that breakout isn't just occasional. It's something that's always there. Maybe it's more widespread. Maybe we start to see those really painful red lesions on the skin that eventually can even lead to things like scarring. Now, we know with acne, there are several different manifestations and different degrees of severity when it comes to acne. So there's a lot to consider when it comes to looking at, okay, what's going to be the best plan of attack to help see results in the skin? So the first question that we need to ask ourselves then is, what is acne? What are we actually dealing with? And a common question that comes along with that is there a genetic link when it comes to acne in our skin? And the answer is absolutely yes. Acne is considered a genetic disease that really targets the Pilosebaceous unit, which is something we're going to dig into quite a bit today. So if you're like, what is she talking about? Not to worry. We will give you all the knowledge that you need to start to understand this unit a little bit deeper. Now, of course, when we think about this genetic component to acne, there have been studies that have been done really comparing acne prevalence in what we call first-degree relatives. So a parent, a sibling, or a child. And what we've seen is that if you have a first-degree relative that has acne, the chances of you having acne increase by up to 4 times. So what this means for us as skin therapists is, let's talk about this in consultation with our client. You know, if we're seeing that this client could be suffering from acne, let's ask that question. You know, do your parents, did they deal with acne? Does your sibling or, you know, any close relatives, that first degree relative, also have these issues? Now, when we look at what acne actually looks like, of course, there are different degrees or grades of acne. So we're not going to spend too much time today looking specifically at the grades, but we know that acne can be characterized by different lesions ranging from comedones, so your blackheads and whiteheads, all the way through to your pustules and papules, those inflamed pimples, or even more severe cases, we may see nodules and cysts. So there are 4 main contributing factors that impact the specific changes and differences when we look at that malfunctioning pilosebaceous unit. So is it possible for us as skin therapists to change genetics? Unfortunately not. But what we can do is really look at what's happening within this unit, this pilosebaceous unit, and understand these triggers further so that way we can actually impact those specific changes or those malfunctions that are occurring within the skin. So before we can actually help our clients understand that, we need to take a bit of a journey beneath the surface of the skin. So this is where I get super, super excited, because we are going to start off by looking at the follicles that we have present in the skin. And then of course, the follicle that's kind of causing a lot of drama in the skin when it comes to acne. So we have three different types of follicles that are on the human body. We have those vellus follicles, where we can kind of identify that peach fuzz, where there's that presence of that small, very thin hair. There's also a sebaceous gland in this case. We have our sebaceous follicles, which we're going to look at in the most detail today, of course, given that we're talking about acne, because this is where we see that there is also the presence of a small hair. But the sebaceous gland tends to be larger and kind of multi-lobed. So there's going to be some issues that are going to occur along with that. And then we, of course, have terminal follicles. So terminal follicles will have that long, stiff, coarse hair, and then a presence of a relatively smaller sebaceous gland at the same time. So here on our screen on the right-hand side, we can see kind of a cross-section of the epidermis and dermis. And here we're looking specifically at the sebaceous follicle, or what we call the pilosebaceous unit. So we see we have the presence of the hair within that hair follicle, and we know that the hair is there to help bring sebum and basically wick it onto the surface of the skin. We're going to talk about the role of sebum and why we actually have sebum in the first place, but we know that that sebum is produced by that yellow multi-lobed gland over there known as your sebaceous gland. So this is where that whole manufacturing of sebum takes place. So we're going to be digging into some of the key functions of the sebaceous follicle, and again, more specifically looking at those malfunctions. So let's go ahead and kick that conversation off together by starting off just overviewing the 4 contributing factors, and then we'll dig into each one separately. So first and foremost, we're going to look at cell proliferation. So looking at the skin cells and what is happening differently in an acneic skin versus that non-acneic client. We're also going to look at sebaceous activity. So not only looking at what's happening within that sebaceous gland that can cause a cascade of events leading to acne, but also looking at the sebum itself. What is this sebum made of? What is the difference with this sebum in my acneic clients versus my non-acneic clients? We're going to look at bacteria. I know a lot of you mentioned this when I said the word acne as we started off today, but bacteria plays a critical role in some of the reasons why we see breakout activity, why it spreads, and why we even see that inflammation present at the same time. And then we're going to kind of weave that string and link everything together, looking at inflammation that ultimately can lead to signs of premature aging. So we know as adult clients, even if we're dealing with acne, we're also concerned about those signs of aging. So it's really about us looking at how can we really make sure we're dealing with the inflammation to help slow down some of that premature aging in the skin. So I hope that sounds good for everybody. Remember, don't be shy. If you have questions, pop them in the Q&A, but hold on tight. We're in for a ride. Let's go ahead and start off by looking at cell proliferation. So when we look at cell proliferation in the skin, there's a few things that are actually happening that causes there to be an abundance of skin cells, okay? And oftentimes we tend to talk a lot about the fact that, an acneic skin produces 4 to 5 times more skin cells. But have you ever stopped to wonder, why does that actually happen? Other than this being, of course, genetic, what are those specific reasons why genetically we see this abundance of skin cells? So there are 3 main things to consider in terms of understanding why we tend to have more skin cells in that acneic skin. So what we're going to look at first is the role of linoleic acid. So when we look at linoleic acid, there has been studies done in the American Journal of Dermatology. And what we know is that if there are diminished amounts of linoleic acid, so there's not enough linoleic acid within that skin, or within that follicle, I should say, it actually affects the composition of certain lipids. So let's dig a little bit deeper. Let's kind of discover this a little bit more. So what we know is that an acneic skin is predisposed to having a lower concentration or percentage of ceramides which contain linoleic acid. Now, why is linoleic acid so important in our skin? Well, if we do not have enough linoleic acid, or we're dealing with that deficiency, what we notice is that this is going to affect our skin's barrier, okay? Now we know our barrier lipids are there to help us with protection, right? So not only are we going to see that, of course, we're going to have a delayed barrier recovery, we're going to see that our skin is more susceptible or prone to bacteria penetration, chemical penetration into the skin. We're going to see transepidermal water loss happening, which is why, again, we see some of that dehydration in conjunction with our acneic skin. But we know that this deficiency in linoleic acid, specifically with our acneic skin, it actually leads to essentially follicular hyperkeratosis, which is basically too many skin cells building up within that follicle. So this will really help us understand why we start to see a plugging of the follicle in the first place. So that's just one part of the puzzle. Next, we need to look at the role of lamellar granules. So I know a lot of you are familiar with lamellar granules. We talk about this quite a lot in our workshops. And we know that lamellar granules are essentially a critical fatty acid. So lamellar granules are there because they help us create lipids, which makes up our barrier lipid layer. Again, a lot of this has to do with that protective layer. Now, what we know in an acneic skin and what we've been able to discover is that acneic clients tend to have less lamellar granules. So what does this mean? Well, how does this contribute to cell proliferation? Well, we know that lamellar granules also contain specific enzymes. And these enzymes, known as calcium sulfatase, actually help with desquamation. So kind of allowing our skin cells to detach and shed as we want them to. So if we're lacking lamellar granules and we're lacking that calcium sulfatase, what happens is that we again get that retention of skin cells within the follicle. All right, we cannot stop there. There's another reason why we tend to see more dead skin cells, and this has to do with our calcium ion gradient. So this is something that you may remember from our previous webinar with the fabulous Candace. She was mentioning calcium ions. But the calcium ion gradient, essentially when we look at a normal skin, if we were to kind of dig a little deeper at the granular layer, the stratum granulosum, what we tend to see is that there's kind of high calcium concentration in that granular layer. And then as we look at the surrounding layers, there tends to be less and less, which gives us that kind of gradient effect. Now, in an acneic skin, what we've seen is that the calcium ion distribution is actually affected or altered by unsaturated fatty acids, just like those found in sebum. So we already know there's lots of sebum in an acneic skin, and I promise we'll dig into that in a few moments. But of course, with that being said, the problem is that we all of a sudden have this influx of calcium ions. And what happens with that is that we tend to find that we have a delayed barrier recovery. We are going to see more of that epidermal proliferation, so more of those skin cells, and more skin cells actually being produced. So, do we need to be able to talk about calcium ions and linoleic acid with our clients? No, but what we need to take away from this is really looking at, okay, the result of these three specific issues in our acneic clients is that we have 4 to 5 times more skin cells. And we need to be able to target that and help to decongest the skin in some way. So let's look at some ingredient solutions. So of course, this is naturally going to incorporate exfoliation of the skin. This is going to be the best way for us to really encourage that desquamation, allow those dead skin cells to be removed from within that follicle, help to clear and decongest the skin. So there's some amazing ingredients that I know you're probably already very familiar with, but starting off with salicylic acid, because this is an absolute hero when it comes to acneic skin. Salicylic acid is lipophilic. It's lipid loving, which means it's attracted to the oil in the skin, and we can actually use that to get inside those follicles to help clear and decongest that buildup of skin cells. We have alpha hydroxy acids, so looking at things like your lactic acid, which can also be super brightening on the skin, mandelic or malic acid, which tend to be a little bit of a larger molecule, so a little less irritating on the skin. We can look at reaching for enzymes, things like papain and bromelain from papaya and pineapple, which kind of works like that Pac-Man, right? Digesting and gobbling up those dead skin cells. We also have some amazing benefits from using retinoids in the skin. Now, retinoids we know can really help with cell regeneration and resurfacing and exfoliation of the skin, which is exactly why retinoids were first introduced as an anti-acne fighting ingredient. So we'll talk a little bit more about retinoids because there's some extra fun stuff I want to share with you about retinoids a little bit later. We have things like our potassium azellyl diglycinate. So this is a water-soluble form of azelaic acid. And this is essentially going to work to reduce some of that congestion, trying to prevent some of those comedones. Also tends to work on excess sebum as well, and some of that inflammation. And then we can also reach for some gentle physical options like our rice bran, our bamboo, which is from traditional Indian medicine, and even sea silt to work to gently kind of buff and polish away any surface dead skin cells on the outer layer of that epidermis. So lots of options here to really focus on exfoliation. So now that we've looked at that exfoliation and how that really works within our skin, we have to also take a little bit of a deeper look, at, of course, the sebum and the sebaceous gland. And I wanted to kind of start off by just talking about what exactly sebum is. Because when we look at sebum, we've really got to make sure that we understand the composition. So sebum is made up of about 41% triglycerides. We've got 16% free fatty acids, 12% squalene, and 25% wax esters. Now we know in sebum that has been tested from acne patients, they have higher levels of squalene and wax esters. So automatically we can start to imagine that the consistency of the sebum is going to be different. So if you were to look at the consistency of a non-acneic skin and had a look at their sebum, it would look kind of like that olive oil there. Whereas if you were to look at the sebum of an acneic skin, it's going to be that thick, sticky, waxy type of consistency, kind of almost like soft butter. So that's definitely going to be an issue when it comes to those impactions or those plugs that tend to form within the follicle. So when we look at the sebaceous gland, which is responsible for producing this sebum, we need to understand a little bit more about how this works. Because on human skin, we have sebaceous glands on our entire body, right? Except for the palms of our hands and the soles of our feet. We have them head to toe otherwise. In fact, when we look at the scalp, we have the largest glands and the highest number of sebaceous glands on the scalp, approximately about 800 per square centimeter, which is a lot. No wonder our hair gets oily, or at least mine does. So when we look at this, we need to understand what's happening with this sebaceous gland. So our sebaceous gland is approximately 0.5 millimeters beneath the surface of the skin. And what happens is that we have specific cells that are basically residing within that sebaceous gland producing sebum. So these cells actually adhere to the basal membrane of this follicle, or of this gland, I should say. And what happens is that these cells, these sebocytes, have a little bit of sebum kind of already in them. Now what happens is as these cells almost mature, they start to fill up with more and more sebum, okay? So I want you to imagine it like a balloon. If you are blowing up that balloon, you can only add so much air before, bam, that balloon's going to burst. So what happens is that these sebocyte cells detach, they continue to fill with sebum, and then they burst, so that finally that sebum is actually expressed into the follicle itself. So what we know as well is not only is this going to be an overproduction, we've got that thick, sticky, waxy sebum that's being produced, but we also know that there is a hormonal component in conjunction with this. I know a lot of you mentioned hormones. It's a big issue, especially for female clients. So let's have a look at that androgen sensitivity. So when we look at hormones, of course, there is a real role that is played by testosterone. And we know that we have a specific enzyme known as 5-alpha reductase, so the 5A reductase that you can see beneath that green arrow. And this enzyme essentially converts testosterone into something known as DHT, or dihydrotestosterone, which is essentially, I like to imagine it like this, like powerful amped up version of testosterone. But what is specific about this testosterone is that it is attracted to specific receptor sites on the sebaceous gland. So always think about that as kind of like a lock and key mechanism. The second that DHT comes into contact with the DHT receptor on the sebaceous gland, the trigger is excess sebum production. So this is exactly why for any of our females who are joining today or our female clients, around the week before our period begins, this is why we tend to see breakout activity due to that influx of testosterone within the body. So, of course, can we stop hormones? Can we get rid of testosterone? No, we definitely don't want to. But what we can do is actually utilize specific ingredients to help us target that conversion and to deal with that excess sebum production. So a great example is niacinamide. I know a lot of you are super familiar with this amazing vitamin B3 derivative, but this is an ingredient that actually works to inhibit some of that 5-alpha reductase activity. And thus, it slows down some of that conversion of testosterone into DHT. We have retinoids. So again, I told you I'd tell you a little more fun facts about retinoids, but retinoids are actually amazing because they can work on proliferating sebocytes. So those sebocyte cells that are kind of creating or filling up, I should say, with that sebum and excreting it into the sebaceous gland itself. Those sebocytes have a receptor, so again, think lock and key mechanism, that binds to retinoic acid, which is the most active form of a retinoid, or vitamin A. And basically, this causes a cascade of events. The first thing that happens is that we're able to slow down or decrease the size of the sebocyte cells, but we're also able to really slow down the growth rate. So that way, we're actually decreasing the production of sebum by up to 90%, which is absolutely incredible. So for our adult clients dealing with acne, this is a star ingredient. We also can use things like zinc gluconate and caffeine, which again are going to inhibit that 5-alpha reductase enzyme. And then look at introducing things like natural earth clays and even activated Binghamton charcoal to not only detoxify the skin, but using those clays to help absorb or wick away some of that excess sebum that's being produced. All right. So time to talk about my favorite, if you can even say that, part of acne, but it's really critical for us to understand the behavior of these guys, our Propionibacterium acnes. So I know we all like to refer to these as P. acnes for short because it's a lot easier to say, but when we look at P. acnes, it's important for us to understand their behavior because if we can impact some of that behavior, we can absolutely help to increase healing, decrease inflammation in the skin, and also help to prevent some of that spread of bacteria that results in more breakout activity. So what do we know about P. acnes? Well, first and foremost, these are part of our natural flora of our skin. They live within the follicle, and you know what? These are not exactly our friend when it comes to acne. With, of course, our P. acnes bacteria, this is considered an anaerobic bacteria, which basically means that it prefers to live in an environment where there is reduced or even no oxygen. So this is going to make sense because when we imagine that plugging that occurs of that follicle, when we've got that thick, sticky, waxy sebum, those dead skin cells making almost like this cement, all of a sudden, this is the perfect environment for this P. acnes to flourish. Now, another reason why they love being in the sebaceous follicle is because they feed on sebum. So again, it's a perfect party zone. They've got lots to eat, there's no oxygen, and what happens is that these P. acnes bacteria are going to use that sebum as an energy source, and essentially they're going to use lipase enzymes to kind of digest or kind of gobble up some of the triglycerides in the sebum, which basically produces this free fatty acid byproduct. And what I want you to remember about this byproduct is that this is what actually triggers free radical attack, but it also triggers inflammation in the skin. So this is why when we see our clients with that inflamed pustule or papule, we say to them, don't pick, don't pop, don't squeeze, because not only are you going to risk scarring of the skin, but you can also risk, of course, spreading the bacteria, because when you see the inflammation, you can be rest assured there's tons of bacteria, your P. acnes bacteria, living beneath the surface of the skin. Now, I must say, the P. acnes is not the only bacteria in the follicle. We have things like Staphylococcus bacteria. We have our Propionigranulosum. and our corynebacterium, but about 87% of the bacteria within that follicle is our P. acnes. So this is why we focus so much on this bacteria. So the other interesting thing, and this kind of refers to something that you're seeing in the image here, when it comes to P. acnes bacteria, they actually secrete a substance known as porphyrins. Now, these porphyrins have a fluorescent quality, which is exactly why when you use things like a woods lamp, you can almost see that glowing from our bacteria. Now, ultimately, this plays in our favor when it comes to using things like LED, specifically blue LED, because what blue LED will do is it will essentially excite those porphyrins, and they will actually release free radicals, which essentially destroys your P. acnes bacteria. So we're essentially killing that P. acnes from the inside when we're using blue LED. So if you've ever wondered how that actually works, now you know. All right, so ingredient solutions. Of course, what can we do to target this bacteria? Well, there's tons of amazing emerging technology that really focuses on targeting the P. acnes, but really being benign or gentle on the good bacteria, that microbiome that we want to keep intact. And this is exactly what our TT technology does. So with our TT technology, we can use things like terpineol and thymol from pine and thyme, and this will actually work to help destroy the P. acnes while remaining gentle on the microbiome or the healthy bacteria. We have things like tea tree, which is an absolutely amazing natural antiseptic for the skin. Colloidal silver is, again, toxic to P. acnes bacteria, so again, can really focus on that specific breakout causing bacteria. We can use our lactobacillus ferment, which is essentially a non-pathogenic bacteria that stimulates the growth of our healthy bacteria. So we're kind of building our skin's army from within. Things like cinnamon bark and Spirea ulmaria, a plant extract there, can really work at slowing down some of that bacteria as well. Okay. All right, so the last little component that we have to consider before we look at some quick treatment options is the role of inflammation. And I always think this is kind of like the thread that weaves everything that we've been talking about so far together. Now, honestly, I know we could spend hours and hours and hours, and I know I could definitely spend hours talking about these things, but really remember, this is all about us just being able to dig a little bit deeper into what is actually happening. So we know when we're doing our skin analysis for our clients, we see the inflamed lesions. We may see the comedones. We may see the excess oil. And it might be a little bit hard for us to understand exactly why that inflammation is present. And then, of course, what can we do to control some of that inflammation? So we know with our acneic clients that they have that kind of immune sensitivity to our P. acne bacteria. So this is definitely going to play a role in why we see the inflammation. So we already said, whenever there's that bacteria present, whether it's actually alive or dead, there's essentially alarm bells going on within the skin, right? Our immune system is going to react. And with that reaction, we release things known as inflammatory cytokines. I always think of these as kind of like your 911 responders for the skin, right? Your paramedics. They are essentially signaling molecules that will actually trigger a cascade of events within that inflammatory process. Now, the part of that is, of course, the activation of our white blood cells. We know that this happens when inflammation is occurring. And when those white blood cells are activated, there are specific enzymes that are released that can actually cause damage to the surrounding tissue, resulting in that inflammation that we see. So this is a whole issue that we could, again, dig deeper and deeper into. But what we need to know about this is that it essentially becomes like this vicious cycle, right? Our P. acnes is present and thriving. We get that trigger of our inflammatory response. We get white blood cells being activated. We have this tissue degradation that takes place and more inflammation. And so the cycle can continue. What's crazy as well is that P. acnes can sometimes be resistant to white blood cells, which is why it's so important for us to really target those P. acnes with those ingredients that we spoke about. Next up, of course, there is the role of sebum. Now, we said the sebum is in excess, right? There is thick, sticky, waxy sebum. And when we think about that, that, as we know, creates that perfect breeding ground for your P. acnes. We can limit the oxygen that's heading into that follicle. Our bacteria is going to grow and grow and grow. And we have more of that lipase reaction, which creates that byproduct, triggering inflammation within that follicle. Now, with that being said, sebum in acne has the presence of something known as lipoperoxides. And this is essentially due to an issue that happens when there's a peroxidation of squalene and a decrease in vitamin E. So what I want us to think about this is that with this whole squalene peroxidation, this is essentially going to trigger in that follicle an inflammatory reaction. And it also contributes to that comatogenesis, or that formation of comedones and that blocking of the follicle. Now, those lipoperoxides are also capable of producing inflammatory cytokines. So of course, again, we've got that 911 responder starting to kick off that inflammatory process. Now, of course, stress. What would be a workshop or a webinar talking about the skin if we didn't take a few moments to talk about the role of stress? Now, we know our immune system is altered by stress. We know that our body creates, or our brain creates and releases, I should say, these neuropeptides, which are essentially, these stress chemicals that are released by the brain. Now, these chemicals can actually trigger things like inflammation in the skin, sensation of burning, bumpiness in the skin. So when you see things like hives or urticaria. And in specific, we know that there's something known as substance P that is elicited by stress. Now, this substance P, is really critical when we look at an acneic skin, because substance P can actually directly increase the size of our sebaceous gland. So this is not good. We already have issues happening within that sebaceous gland that we've looked at genetically. And if we add stress to the mix, we're even further stimulating that sebaceous gland. We also know that substance P can actually increase the size and the number of the sebocytes within that gland. So ultimately, we know that there's going to be far more sebum being produced when we are under that emotional stress. When we add to that, stress is becoming kind of the new norm for us, especially given what our globe has been through recently. And with stress being that more new normal within our lives, we tend to perhaps have less of a focus on some of the healthy habits that we should be doing. Perhaps our diet goes by the wayside. Maybe we're not taking as good care of our skin as we normally do when we're not as stressed out. We know that cortisol, another stress hormone, also results to dehydration within the skin. And we know as well that with that being said, stress can actually slow wound healing by up to 40%. So that breakout may be, more persistent. It may stick around much longer. We may see more of that post-inflammatory hyperpigmentation. Now, we also know that we have inflammasomes that are part of this whole inflammation process. Now, these inflammasomes are actually activated by your P. acnes, and they basically lead to the production of pro-inflammatory cytokines. So again, think of that kind of 911 responder. Now, this is going to contribute to that immune response. So what actually happens is there's going to be kind of a rapid initiation of that inflammatory process upon sensing pathogens. And in this case, the pathogen we're talking about is P. acnes. So again, it's kind of all linking together. So when those P. acnes actually interact with your inflammasomes, there's going to be more of that pro-inflammatory cytokine release, and thus we're going to see more inflammation on the skin. So what do we need to do with this information? Well, we've got to target the inflammation by using anti-inflammatory solutions. So we can use things like niacinamide, again, here as an anti-inflammatory, again, such a hero ingredient for our acneic skin. We've got our Avena sativa, so our oat kernel, which we know is antipyretic, so it's anti-itch. It has an excellent ability to slow some of that inflammatory response. Lavender, things like our essential fatty acids, including linoleic acid. Remember, we spoke about in the beginning of our webinar that acneic skin is deficient in linoleic acid. So let's kind of build up that store and really kind of apply what's lacking in that skin. This can ultimately help to build that protective lipid barrier and also help us to ultimately have that increase in wound healing ability. Things like vitamin C is a great option as well. And something super cool to point out here is that red hogweed root, I'm so tongue-tied, my goodness, and acetyl tetrapeptide 15, both can actually be ingredients that can work on that neurogenic inflammation, so that brain-skin connection. So slowing down the impact that some of those stress hormones can have, leading to, or stress chemicals, I should say, leading to that inflammation. So what does this mean for us as skin therapists? Well, we know when it comes to treating acne, we have to focus on all of those 4 contributing factors in order for us to really see a result, which we're going to just recap shortly. But before we do that, we have to consider those additional triggers. And again, this relates back to consultation being absolutely king. We need to find out, what is our client's lifestyle like? You know, what are they exposing themselves to that could also be contributing to some of the breakout activity and acne in the skin? What is their diet like? Are they intaking a lot of dairy, which we know has an impact on acne? Maybe it's a lot of processed foods or sugar, all the things we love, right? Maybe it's cosmetics, ingredients that are comedogenic on the skin. Perhaps we're overstripping the skin and not using the correct products that could also be triggering some breakout activity. Now we always have to think of as well, you know, for many of us, I know in most of Canada, we're required to wear a mask when we're going out in public spaces, specifically indoor public spaces. So that constant friction and irritation is leading to a lot of our clients seeing more breakout activity. And what are their bad habits? Are they picking? Are they popping? Are they squeezing those pustules and papules? We really need to make sure that we're using consultation and our interaction with our clients with our skin analysis to help teach them about these triggers. And ultimately what the goal is that we're able to use the professional treatment and partner it with home care to give us that 360-degree approach. So of course, remember in your professional treatment, deep cleansing is critical. How can we provide that professional resurfacing? Maybe even looking at more advanced options like chemical peels. Extractions, making sure we're not extracting those pustules and papules, but we're rather working on the comedones within the skin. Can we incorporate technology such as blue LED that we spoke about? Maybe it's microcurrent to increase penetration, or ultrasonic. Maybe we want to look at more advanced options to try and deal with scarring of the skin. Maybe it's IPL or microneedling. So we need to start thinking about developing that treatment plan that is going to really focus on all of these issues. Number 1, let's control that overactive sebaceous gland. Number 2, let's make sure we're dealing with the cells in the skin, that overproliferation. Let's target that bacteria and let's really work to soothe and calm the skin and deal with that inflammation that's present. And then when we can have our clients on a routine that focuses on all of those issues, that's when we're truly going to see some dramatic changes for our client's skin. So with that, I know that was a ton of information coming your way in such a short webinar, but I do want to reach out to Beth and see, do we have any questions, comments, concerns? Oh, you're muted, Beth.
How many times have I done this, right? Okay, yes, thank you so much. That was really great information. We do have some questions in the Q&A. I don't know if you want to go ahead and click through your last slide, and then we'll just put us up into kind of like a personal chat so everyone can ask good information. So
Sure.
I have, again, if you're on the call with us and you're like, you know what, okay, now I've got some questions, go ahead and put those into the Q&A section and we'll be able to go through those. So let me go ahead and click into that and I will just start with these questions.
Awesome.
So the first one I have here is, can you speak about acne maybe within the beard area? Is there a specific way to like treat it in the treatment room? Home care, I think like ingrowns are definitely that folliculitis barbae that tends to happen quite a bit with shaving, are definitely seem to be a concern. So if you could answer that, then we'll head into the next question.
Absolutely. That's a great question. So thank you for asking that question. So specifically when we're looking at acne within the beard, what is interesting is that the beard is actually seldom involved in the formation of acne because there is the presence of that coarse terminal hair that helps us basically wick away all of that waste and excess sebum up to the surface of the skin a little bit more effectively. But we do know that the follicle itself can become infected essentially. And like Beth mentioned, we see that pseudofolliculitis barbae, which is essentially the ingrown hair.
Mhm.
So what's great is that when we think about how to treat that, it can be very similar actually in terms of how we target breakouts within the skin. So what we need to think about is, okay, how can we, number one, prevent some of that sort of blocking that's happening within those beard follicles. So really encouraging clients who are dealing with ingrown hairs to seek out exfoliation that's really going to be beneficial for their skin. Whether that's a chemical exfoliant, maybe you want to introduce them to something like salicylic acid, which can really help keep follicles clear in general. Same thing within the treatment room, really making sure that we're providing a really great deep cleanse of the beard area, which of course can sometimes be tricky depending on how coarse and thick that beard is. But deep cleansing, providing that exfoliation, and then really working on using some antiseptic ingredients like things like your tea tree or any of those antibacterial ingredients that we discussed, while also targeting the inflammation to bring down that inflammation that's happening within that specific follicle. So it's interesting. It's not exactly the same as acne, but how we target it can be very, very similar in terms of making sure that we're preventing and then treating that ingrown hair.
Okay, perfect. Even to think about like when you're as a therapist working on a gentleman who has a beard area that we're actually going kind of down, we're not going up against it, and even giving your client those guidelines, right? To kind of minimize some of that, some of those ingrowns as you mentioned. How many times per week should an acne skin be exfoliated? So if someone's exfoliating at home, what would you recommend?
That's a great question. It really does depend on the type of exfoliant. So, when we look at exfoliation, of course, there are options that can be a more gentle daily application of exfoliation. So, generally speaking, those will have some form of physical exfoliant ingredient in there, and then perhaps a more mild chemical exfoliant. So, that could absolutely be a great option, making sure that we're keeping it gentle in terms of that physical exfoliant, not to cause any over irritation or rupturing of those lesions themselves. If you are looking at something that's perhaps a higher concentration, maybe a little bit more active in terms of those chemical exfoliants, maybe it's something that you recommend maybe once to twice a week. But I think, also think about your client's lifestyle. Is this someone who is going to remember to exfoliate once a week with that more powerful option? Or do we need to get a little bit creative and find products that can be used on a daily basis so that it becomes kind of like brushing your teeth? You're not going to forget about that regular exfoliation that's really required for treating an acneic skin. So I would say, there's no straight answer to that question, but really take into consideration your client's lifestyle and their overall kind of skin health when you're looking at introducing exfoliants.
Okay, great. We have a question here too. Says, is it best for us to calm the skin first before maybe moving on to advanced skin treatments like peels? So if you've
So
got
again, kind of
inflammation and breakout, but yet it's not active breakout, so they're ready to maybe have a resurfacing option. Should we also make sure that that sensitivity is kind of calmed down?
For sure. We definitely want to target the inflammation at the same time. It obviously depends on the severity of the inflammation in terms of how we decide to build out that treatment plan for our client. And it really also depends on, what are they using at home? Are they already used to using some type of chemical exfoliant? Or is this somebody who is brand new to exfoliation where maybe we do want to kind of start things off a little bit more gentle, help their skin build up a bit of tolerance and deal with some of that inflammation, and then perhaps we maybe select something like a chemical peel as an option for them.
Okay, great. Do you have any thoughts about if someone, so kind of sticking on the formation of like the sensitivity, there
Mhm.
are clients who have eczema and they also can have acne or they can have some breakouts. Do you have any advice on how to treat that type of client who might have more of that skin disorder in combination with breakouts.
Yes, definitely. That is a tricky one. Of course, that's a tough client that is really probably feeling so at their wits' end, right? Dealing with this oversensitivity and then also the acne as well. So
Mhm.
I would say, if it's a situation where that eczema client has maybe one or two breakouts that are just occasional, maybe they're hormonally influenced, or maybe it's connected to things like diet or stress, perhaps introducing a spot treatment option to those specific breakouts. We know with an eczema client, we want to be exfoliating the skin gently anyway. So that can be definitely something to start incorporating for their routine, and of course within that professional treatment. But I think, with eczema, because it is oftentimes such well, it is always an inflammatory issue where we see severe sensitivity and impairment of that barrier, we have to think about maybe it's best to get that barrier a little bit further intact. Let's kind of deal with some of those eczema lesions that could maybe be present on the skin. And then we can look at targeting some of the breakout activity. So kind of depends on what type of acne you're seeing or what type of breakout activity that's happening. But I definitely say an easy option is, if it is just the occasional option or occasional breakout, we can just use something like a spot treatment to target those specific areas while we're trying to essentially refortify that barrier and just get that skin to a bit of a healthier state.
Okay. And I think also too, there's a lot of products out now that are more prone to like adult skin. So it's not as harsh and as damaging and as drying to that. But I like your answer about really making sure we're going to keep the skin, still keeping it hydrated, protected, and soothe, and then being able to really kind of work on the spots as well.
For sure.
I've got a lot of great questions coming through here. This is a really popular one. I think a lot of us get this question from our clients who do have breakout. And the question is really all about daily moisturizers for acne sufferers when it comes to, yes, they should do it, and water or oil based. I mean, I'll let you take this one.
Oh, this is one of my favorite questions, Beth. So thank you to whoever asked this question. This is a tricky one because it requires us to really educate our client. Because what can happen is, if you're that person that's getting excess oil, you have acne, you're breaking out, there's so much happening in terms of the acne lesions on the skin. The thought of using something like a moisturizer may seem counterintuitive to you as the client, right? You might think, well, why do I need to moisturize my skin when I've got all this oil, right? It's like, I don't need anything else. I'm good. But the truth is that we know within the skin, oil and water are two different things, but they kind of work together. So I always use this analogy, and I used to use this with my clients all the time. It's like when you go to your favorite Italian restaurant and they give you a little bowl of balsamic vinegar and olive oil to dip your bread in. I'm a sucker for it.
Okay.
We know that the oil and the vinegar do not mix together, right? They don't blend together, but they work really, really well together. And it's the same in the skin. Even though our client's skin may have excess oil that's obviously leading to this acne or to those breakouts, we need to still add water to the skin. So this is really, really critical. We want to make sure that we're using perhaps even a lighter weight moisturizer, something that's perhaps oil-free if your client's kind of a little bit moisturizer phobic. And then, you know what? As we kind of get to know that client, and as they get to understand their skin a little bit further, we know that there are actually some oils that are excellent for an acneic skin.
Mhm.
So I would say start with the basics. Let's get them on the moisturizer. Let's seek out a water-based option that is light in weight, something that absorbs quite quickly on the skin so that that client's not feeling any type of residue left over, so that we can boost up the water content in the skin. And then, of course, we could always look at adding specific oils that could actually work to help with your skin's barrier recovery, some of that deficiency in linoleic acid and things like that, which can actually help with the acne as well.
Okay, great. So staying on thinking about kind of types of acne, there's obviously, we've got our blackheads, our, comedones, we've got pustular and papular activity, but there's definitely an interest here about cystic acne, which we know that changes on the kind of grade level, if you will. So it is very hard to treat. Do you have any suggestions about treatments or ingredients or any advice we should be giving to our clients who maybe like have that cystic acne that just never really disappears. It just is, it becomes very painful and maybe really inflamed. Kind of, what would you recommend?
Absolutely. So as you mentioned, Beth, again, great question. Here we're looking, when we're looking at cystic and nodular acne, this is a higher grade of acne, which we have to at some point look at what we're going to be able to achieve as professional skin therapists. And sometimes when we look at that more nodular, inflamed, super painful type of acne, those higher grades of acne, we are going to need physician intervention. So sometimes we need to actually consider, maybe this is a client who should be seeking out anti-acne medications, prescription products that can help with that cystic or nodular acne. Now, that's not to say, oh, well, there's nothing we can do as a skin therapist. There's absolutely such a critical role that we can be playing with that client, because their skin health is going to be so important, especially while they're on some of those prescriptions, whether it's an oral anti-acne or something topical. So that's where, we are there to maintain skin health. Let's keep using those anti-inflammatory ingredients. Let's really work on boosting hydration and keeping that skin health at its optimum level and dealing with perhaps some of the side effects that we may be seeing from those medications. So the one thing to consider there, of course, is if our clients are on prescription oral anti-acne medications or even something that's topically applied, we do want to be mindful that we should be avoiding the exfoliation component of our treatment and that at-home routine. So if it's something topical, your client should be off of that for at least 2 weeks before we start introducing exfoliation. And if it's something more oral, like your isotretinoin or formerly known as Accutane, we would probably want to wait at least 6 months before we start to reintroduce exfoliation. So the goal is to calm, soothe, hydrate that skin.
Okay. So speaking of treatments, we've got a couple questions around treatments here as well. So I'm just kind of going down through the list. Everyone, thank you so much. These questions have been really, really fantastic. Okay, so the question so again, I'm kind of going through these. Thank you guys for being patient. When it comes to someone who is actually needs to have an acne skin treatment, is there a recommendation of how often they should be coming in if they're suffering from stubborn kind of constant breakouts? Not the kind of here and there, but it just seems to be going on, for a while. So that's part one. How often should they come in treated? And do you personally have any advice about designing these treatments so that we aren't impacting that skin negatively? Because sometimes I think our clients want us to go really aggressive, like, I want to clear up this acne, do what you need to do. But yet, as you mentioned, we need to calm and soothe as well. So kind of two parts to that.
Yeah, great question. So in terms of how often the client should be coming to see you, it depends on the type of treatment you're offering them. So, something like an LED treatment, the more the merrier. The more often we can see that client, we're going to see amazing results. Something like a chemical peel, though, maybe we want to be waiting 2, 4, 6 weeks in between treatments, depending on that client's skin. I would say what also is important for us to understand is, what is our client doing at home to prepare their skin, but also to maintain their skin at home? And I know something that we often talk about in things like chemical peels is getting our client to start skin priming, right? It's kind of like sweeping the floor before you mop it. So let's make sure that they're on some type of exfoliating product at home so that their skin's getting used to that activity. And then we can maybe see them every 2 weeks or every 4 weeks. So it kind of depends on your client's commitment in terms of what they're using at home and what their skin is already used to in terms of that tolerance, which is definitely going to come up when you're talking in that consultation process. Did I answer that whole question? Like, was that everything?
And I think the other thing too, is there anything, like maybe a personal thing that you've done when you've customized or created a treatment for a client who has breakouts? Anything that you, like a rule of thumb, as you as a professional go, this is definitely something I always do?
Absolutely. So I think for me, the kind of overarching thing that I really want to focus on when it comes to professional treatments and building out those plans is professional level exfoliation. I think sometimes as skin therapists, when we see that acne that's maybe, like you said, Beth, a little bit more widespread or perhaps more persistent, it's not just the occasional breakout here and there, we might get a little bit nervous about, can I use a professional strength exfoliant? Maybe I should kind of dial things back a little bit. And, that's not just saying, go crazy and not have any caution, and throw that caution to the wind. But I would really encourage you to not be scared of utilizing professional exfoliants. Remember, when you think about exfoliants, especially things like chemical exfoliants, you're in control of how long that exfoliant is left on the skin, what type of exfoliant you're using, and you can absolutely customize that to that client's tolerance. But I think when your clients can come and see you when they're at their wits' end with that acne that is stubborn, it's persistent, it's emotional, they may be seeing scarring, exfoliation at a professional level is where you're going to really start to impact change. And then following with that, an absolute dedication for a great at-home routine, because we can do all of the amazing treatments. I mean, blue LED is honestly one of my absolute favorite go-tos to be incorporating at any opportunity that I have with an acneic skin. But you can do all of these amazing treatments, and if your client isn't using products at home that are tailored to what their skin really needs and are going to maintain and boost the results that you're trying to achieve in the professional treatment, then it's going to be really hard to actually get a visible change and to see those results that they want to achieve. So I think it's really about building that relationship, having that agreement, and then of course not being too scared to introduce things like professional level exfoliation and even things like LED if you have technology available to you.
Right, right. And really paying attention to the client's skin, because if it's looking inflamed, irritated, if they're complaining of like soreness, if they picked, like you've mentioned, then we're just, we're going to follow the less rule. We're going to remove that exfoliation step and just, as you mentioned earlier, work on soothing and hydrating it and anti-inflammatory. I know we're a little bit over on the webinar. I always like to just make sure we can get these questions going. I do have one last section. I think it's been a very popular question. For those of you who've asked questions today, if we didn't get them to them live with Brooke, we're going to try to go on here to the webinar and get an answer to you as well afterwards. I know a lot of us are kind of staying on and just kind of listening to it. We'd love to have you stay with us. But again, if you have to jump off because you've got to get to work, take care of the family, absolutely. We thank you so much for joining us. So Brooke, last kind of big question, of course, is around LED, which is just what you were talking about. Yeah. And the questions around this too are, how often could someone use LED if they are more acne prone?
Mm-hmm.
And what are your thoughts about, especially during this time where not every state and every country, the salons are not all open yet. So if someone has an at-home LED mask, what could we recommend to that client to do with that, to use it, or really how often? So it's kind of how often can they use it? And what is your opinion about the kind of LED at home?
All right. So first of all, the LED at home, I always say to all of our skin therapists, professional is always better, right? There's a reason why some things are perhaps reserved for the professional skin therapist, perhaps using better technology, and we're going to be able to see better results with that. But that being said, I know a lot of clients are really seeking out at-home options to help with their skin.
Mm-hmm.
The thing with LED that we have to remember is that it's not an ablative treatment. So it's not going to cause heat. It's not causing inflammation on the skin. So it is something that your clients can use quite regularly to try and really see that change and really focus on, of course, that P acnes that we spoke about. I've dealt with clients in the past where I was seeing them 2 to 3 times a week for blue LED treatments. Of course, I wasn't doing excessive exfoliation within those treatments every single time. But it is something that if you can get them on a plan where we can see them quite regularly, of course, there's going to be budget kind of issues to consider there as well. But it's not something that's ablative on the skin. So you're not going to see that there's any kind of downtime required or that you could essentially overuse the LED.
Okay. All right. Perfect. Excellent. Well, again, we have so many, we could be on here for another 3 hours.
I love it.
answering all of these questions. Again, I promise you guys, Brooke and I are going to get to these questions for sure if we haven't been able to answer them verbally. I do want to say thank you so much for being here today and talking about this. We've been getting such great feedback from everyone who's participating today and leaving us comments. Thank you so much. We just greatly appreciate everyone tuning in and being dedicated to education during this time. Now, if you are like loving this topic and you're thinking, I need more, I need like hours more of this, you can sign up for our Skin Series acne course, because Brooke just brought to you just a little bit, right? It's the tip of the iceberg.
Yep.
It comes to education. So that's Skin Series Acne. We do offer that on IDI streaming through dermalinstitute.com, and that's going to be found through our Los Angeles location. So head up to dermalinstitute.com for everything about education when it comes to some of these advanced topics. We've got, you can book online. We've got our course schedule all the way up there for you as well. We are doing more of these industry expert webinar series continuing next month as well. And next month, we are going to be talking about sensitive skin and inflammation with one of our amazing instructors from the UK. Well, all of our instructors are amazing. So we're just going to keep the topics coming, and that will be with us in September. And so just want to make sure that you just head up there to the website and get that information. If you have any questions, again, you can always send us an email, chat with us on dermalinstitute.com. Brooke, I'm going to keep you on here for a little bit so we can maybe just chat for a while and answer some of these questions for everyone. To everyone out there today, have a fantastic Thursday or Thursday night, especially if you're tuning in from the UK. And Brooke, thank you again for just all of your information. It's been incredible having you with us today.
Thank you so much for having me, and thank you everybody for joining. It's been such a pleasure to connect.
Perfect. All right, so I'm gonna have you stay on here with me. We're gonna see if we can kind of answer some of these questions, and we'll see everyone next month for another industry expert webinar series.